Discovering a lump or bump in the vaginal area can be a jarring experience, and I want to take a moment to talk about it because it's something many of us might face at some point in our lives. First off, let's acknowledge that it's completely normal to feel a rush of fear or confusion when you stumble upon something unexpected in your body. Our minds can spiral into worst-case scenarios, and that's okay. But here's the important part. Many of these lumps or bumps are benign, meaning they're not dangerous, and they can often be treated easily. So let's dive into this together, arm ourselves with knowledge, and empower ourselves to take action. So what are these vaginal lumps or bumps? Essentially, they refer to any abnormal growth, swelling, or raised area in or around the vaginal region. They can vary in size, texture, and location, and they might appear suddenly or gradually. Some might even resolve on their own without any intervention. But understanding what we're dealing with is key to alleviating unnecessary worry. Let's talk about some common culprits. One of the more frequent issues is a Bartholin's cyst. You might be wondering, what on earth is that? Well, Bartholin's glands are located near the vaginal opening, and they secrete fluid to help with lubrication. Sometimes these glands can become blocked, leading to a painless cyst. However, if that cyst becomes infected, it can cause pain and swelling, making it uncomfortable to sit or have intercourse. If you notice swelling near the vaginal opening, or if it feels painful, it's worth checking in with a healthcare provider. Treatment can range from warm compresses and Cysts baths to minor surgical drainage if necessary. Another common issue is sebaceous cysts or ingrown hairs. These often form when a hair follicle or oil gland gets blocked. They're quite common in areas with hair and can pop up after shaving or waxing. If you find a small, firm bump under the skin, it might just be that. While they can sometimes be tender or red, warm compresses and gentle exfoliation can help, and avoiding tight clothing can prevent them from forming in the first place. If it becomes painful or infected, a quick trip to the doctor can sort it out. Then we have genital warts, which are caused by certain strains of the human papillomavirus, or HPV. These warts can appear as small flesh-colored bumps that might cluster together. They can be painless or cause mild discomfort, but the good news is that there are effective treatments available, including topical medications and cryotherapy. And let's not forget the importance of vaccination against HPV, which can help prevent future occurrences. Now, if you've ever experienced painful blisters in the genital area, you might be dealing with herpes sores caused by the herpes simplex virus. These can be quite distressing, often accompanied by itching or burning sensations. While it's a lifelong condition, antiviral medications can help manage outbreaks and reduce symptoms, allowing you to maintain a fulfilling life. Let's shift gears for a moment and talk about skin tags or moles. Skin tags are benign growths that often appear in areas of friction, while moles can vary in size and color. If you notice soft, fleshy growths or pigmented spots, they're usually harmless. Skin tags can be removed for cosmetic or comfort reasons, and any changes in moles should be evaluated by a dermatologist to ensure everything is okay. Another thing to look out for is folliculitis, which is inflammation of the hair follicles, often caused by shaving, waxing, or bacterial infections. You might see small red or white bumps around hair follicles, sometimes with tenderness or mild itching. Avoiding irritants and using proper shaving techniques can help, and in more severe cases, antibiotics may be necessary. Now, I need to address something that might sound alarming, but it's important. While rare, some lumps can indicate more serious conditions like vulvar or vaginal cancer. If you notice persistent, irregular lumps, non-healing sores, or unexplained pain or bleeding, it's crucial to seek medical attention. Early diagnosis can make all the difference, and if cancer is suspected, your healthcare provider may recommend a biopsy or imaging tests to confirm the diagnosis. Understanding these possibilities can empower you to take the right steps. If you ever find yourself in a situation where you discover a lump or bump, remember that knowledge is your ally. It's okay to feel concerned, but don't let fear paralyze you. Instead, take a deep breath, gather information, and reach out to a healthcare professional. They're there to help you navigate these concerns and provide the support you need. Remember, your body is your own, and taking charge of your health is a powerful act of self-love. So let's prioritize our health, stay informed, and continue to support one another on this journey. You're not alone in this, and together we can break the stigma surrounding these discussions. Let's embrace empowerment through knowledge and take the necessary steps to ensure our well-being.